Hey friends, welcome back. Are you finding difficulty in falling asleep? Difficulty to sleep is indeed horrible. It can cause physical as well as psychological issues. So, today let's discuss about different types of sleep disorders. Sleep disorders are mainly classified into three categories: dyssomnias, parasomnias and disorders due to other medical conditions. In dyssomnias, the sleep itself is pretty normal, but the client sleeps too little, too much, or at the wrong time. So, the problem is with the amount or quantity, and sometimes with the quality of sleep. Common dyssomnias are insomnia, hypersomnia, narcolepsy, sleep apnea, insufficient sleep or sleep deprivation. Let's see one by one in detail. Insomnia is described as the inability to fall asleep or remain asleep. Persons with insomnia awaken not feeling rested. Insomnia is the most common sleep complaint. Acute insomnia lasts 1 to several nights, and is often caused by personal stressors or worry. If the insomnia persists for longer than a month, it is considered as chronic insomnia. Insomnia can result from physical discomfort, and more often from mental tension or anxiety. People who are habituated to drugs, or who takes large amounts of alcohol, are at high risk for insomnia. Clinical manifestations of insomnia are difficulty falling asleep, waking up frequently during the night, difficulty returning to sleep, waking up too early in the morning, unrefreshing sleep, daytime sleepiness, difficulty in concentrating, irritability. Treatment for insomnia is development of new behavioral patterns that induces sleep. Create an environment that induces sleep during bedtime. Create positive sleep thoughts. Hypersomnia refers to the condition where the affected individual obtains sufficient sleep at night, but still cannot stay awake during the day. Hypersomnia can be caused by certain medical conditions, for example, central nervous system damage and certain kidney, liver, or metabolic disorders, such as diabetic ketoacidosis and hypothyroidism. Treatment of hypersomnias include treating the underlying disease conditions. Narcolepsy is a disorder of excessive daytime sleepiness, caused by the lack of the chemical hypocretin. Orexin or hypocretin is a neuropeptide that regulates arousal, wakefulness, and appetite, in the area of the CNS that regulates sleep. Clients with narcolepsy have sleep attacks, or excessive daytime sleepiness, and their sleep at night usually begins with a sleep onset REM period, that is, dreaming occurs within the first 15 minutes of falling asleep. People sleep several times a day, even when they are conversing with people or while driving. CNS stimulants and antidepressants are the drugs used to treat narcolepsy. Sleep apnea is characterized by frequent short breathing pauses during sleep. Although all individuals have occasional periods of apnea during sleep, more than 5 apneic episodes longer than 10 seconds in an hour is considered abnormal, and should be evaluated by a sleep medicine specialist. Sleep apnea is most frequently diagnosed in men and postmenopausal women. It may occur during childhood, also. There are 3 types of apnea, based on the cause. 1. Obstructive apnea. 2. Central apnea. 3. Mixed apnea. Obstructive apnea occurs when the structures of the pharynx or oral cavity block the flow of air. Enlarged tonsils and adenoids, a deviated nasal septum, nasal polyps, and obesity predispose the client to obstructive apnea. Central apnea occurs due to defect in the respiratory center of the brain. Clients who have brainstem injuries often have central sleep apnea. Mixed apnea is combination of obstructive and central apnea. A prolonged disturbance in quality and quantity of sleep can lead to a syndrome called as sleep deprivation. It is not a sleep disorder but a result of prolonged sleep disturbance. It produces various physiological and behavioral symptoms, based on the severity of deprivation. Individuals with sleep deprivation may develop attention and concentration deficits, reduced vigilance, distractibility, reduced motivation, fatigue, diplopia and dry mouth. In parasomnias, something abnormal occurs during sleep itself, or during the times when the client is falling asleep or waking up. The quality, quantity, and timing of the sleep are essentially normal. Most common disorders are bruxism, enuresis, periodic limb movement disorder, sleep talking, sleepwalking. Bruxism usually occurring during stage 2 NREM sleep, characterized by clenching and grinding of the teeth. This clenching and grinding of the teeth can eventually erode dental crowns, cause teeth to come loose, and lead to deterioration of the temporomandibular joint, called TMJ syndrome. Enuresis or bedwetting during sleep occurs mainly in children over 3 years old. More males than females are affected. It often occurs 1 to 2 hours after falling asleep. Periodic limb movement disorder is a condition in which the legs jerk twice or 3 times per minute during sleep. It is most common among older adults. It responds well to medications such as levodopa, pramipexole, ropinirole, and gabapentin. Sleepwalking or somniloquy is talking during sleep. It occurs during NREM sleep before REM sleep. It rarely presents a problem to the person, unless it becomes troublesome to others. Sleepwalking or somnambulism occurs during stages 3 and 4 of NREM sleep. It is episodic and usually occurs 1 to 2 hours after falling asleep. Sleepwalkers tend not to notice dangers, example, stairs, and often need to be protected from injury. Disorders due to other medical conditions. These disorders are associated with medical or psychiatric or other illness. Usually the disorders that cause sleep disturbance includes depression, alcoholism, thyroid dysfunction, peptic ulcer, COPD. That's all about sleep disorders. Guys, our next video is on nurses' responsibility to promote sleep and sleep hygiene. Stay tuned. Thanks for watching. Hope you liked the video. If you are not subscribed to our channel yet, please do subscribe and share the contents with friends too. See you with another video. Take care.